Okay, I think we're going to get started. Once again, welcome to the IDF 2022 PI Conference. My name is Christopher Scout-Chunes, and I'm Vice President of Research at the Immune Deficiency Foundation. I will be your moderator for this educational event. This morning, Dr. Victoria Dimitridis, we practiced that and I blew it. We'll be presenting on the topic of general care, a zebra life. There'll be time for questions at the end of the presentation. Please submit any questions you have to present in the Q&A section of the platform. I'll be monitoring that. Victoria Dimitridis is the Chief of Division of Pediatric Allergy, Immunology, and Rheumatology, and a clinical professor in the Department of Pediatrics at the University of California, Davis Medical Center. She has a special clinical interest in patients with concerns for immune deficiency, recurrent severe unusual infections, immunoglobulin replacement, immune dysregulation diseases, or a family history of immune deficiency. She is also involved with immune evaluations for the California Newborn Screening Program and for patients with various genetic syndromes, in particular, 22q deletion syndrome. Welcome, Victoria. I'm going to go ahead and turn this presentation over to you now.
Thank you so much, Chris. I appreciate it. Good morning, everybody. Thank you so much for having me here today to talk about general care for individuals with primary immunodeficiency. I'm going to advance my slide. Possibly, there we go. So I have just a couple disclosures, the scientific advisory boards that I'm on, but none of which are relevant for today's talks. So we know that patients with primary immune deficiency have greater self-care needs, and that's one of the main reasons we have these discussions in order to remind everyone that our community needs more targeted interventions and commitments to their medical care. The reason for this is as you take charge of your own medical care, you can become a more active participant in the outcomes. And of course, as I say to everybody, healthy habits are not difficult, but commitment and consistency is key. So that's kind of our general summary. What are we going to talk about today? More simple things: general health measures, nutrition, exercise, sleep, stress, infections, and all of these things and how they basically impact your general care. So one of the first things we'll talk about is preventive hygiene, and we'll go first with personal hygiene. This seems like a no-brainer, right? Regular bathing and showering, as I tell my adolescent patients, with soap, of course, regular toothbrushing, and of course, dental care. The important things about this are that we can decrease bacterial and viral loads on our bodies that way, and of course, make sure that we keep the areas free of infection because of that. So these are important measures that you don't necessarily think about on an everyday basis in terms of impacting your care, but it really can change your trajectories in terms of infection profiles. The next prevention measure we use is hand hygiene. I know we all have heard a lot about this lately. We know that hand washing is really important around meals and after contacts. When you don't have access to actually running water and soap, you can use hand sanitizer and antibacterial wipes. The most important thing about this is not necessarily that your hands are clean. Your hands can be dirty if you want them to be. But what's the key factor here is the transfer from your hands to your face, touching your eyes, your nose, your mouth. Those are things that actually can cause infection to be kind of seeded inside. We know through studies that there are lower rates of seasonal virus transmission with increased hand washing. And in fact, they did a children's camp study looking at kids who washed their hands more frequently and less frequently and found that there was less infections overall in the group that were washing their hands more. So it really does work. Clean hands count. The next preventive measure that we're using now is masks. This is not a new preventive measure. We've been using it for decades. We know it is a physical barrier to transmission of infections. We know it's a physical barrier to transmit the infection to yourself, right? So if you're unable to actually contact your nose and mouth, it's a much easier block for your hands that should have been clean already to get to that space. And then it also has been shown to slow community transmission of general diseases. What I really liked about the discussions we've been having on masks is that they're focusing more on something called the viral inoculum. That is the overall infection burden that can be transferred from one person to another. People who wear masks have a much lower dose of infection that they will get, and therefore any disease that they do get is more mild. So it doesn't necessarily stop all infections, but the infections you would get probably are going to have a more mild course. So this past few years have taught us a lot of things, but also for the PI community really reinforced things we already knew about. Personal hygiene, hand hygiene, masking, physical distancing, 6 feet is exactly what you see in front of you here, maybe a little extra. And then also other things that probably most of our patients have already been doing, which is avoiding enclosed spaces for prolonged periods of time without good ventilation. So all of these measures that we have been discussing the last few years for not spreading, specifically COVID-19, also work for the general PI community for all types of infections, not just viruses. Vaccines. So current vaccination guidelines for primary immune deficiency patients is that they can receive most vaccines, including COVID-19. It's important that you partner with your primary care provider and your immunology provider to find out which of these vaccines are safe for you. Some of them may not be indicated in your condition. Some of them may not be needed based on therapies that you're on. For instance, some vaccinations are not necessarily recommended when you're on immunoglobulin replacement. However, I will mention flu vaccines are not required. Flu vaccines are recommended for all patients who are on IgG replacement because the current strain of the flu vaccine is not contained in your IgG mixture of antibodies. So it is important to make sure you do get your vaccine in the fall every year when you're on IgG replacement. There's a little more caution that we have with live vaccines. So that's MMR, varicella, some shingles vaccines are live. Those are things you should discuss with your provider before you get those, because there are some patients with T-cell issues who may or may not be able to receive these vaccines. Now, we talk about vaccines in our population of primary immune deficiency patients, but we should also mention all the contacts. So family members, caregivers that are in the circle around our patients should also be vaccinated in order to prevent transmission of any types of infections to our patients. So let's talk for a second about your medical home. This is your primary care provider who you go to for the general first stop when you need primary care. They are the coordinator of your medical care and your medical records. You can see them for general visits and sick visits, and it's important to establish a baseline with them so that you are not only going to see them for sick visits. This way, they can kind of keep track of your ongoing general care, but also have a secondary running track of any illnesses when you come in to see them. They will help direct immunizations, and they will importantly help direct preventive care. So things that we don't think about, things that may have fallen by the wayside during these last 2.5 years as you were really focusing on hunkering down, things like heart health, cholesterol screening, gastrointestinal health, like cancer screening, also male and female reproductive health. These are all things that your primary provider can help initiate workups for. A tip for some patients, in their insurance companies can actually offer an application for a case manager. This case manager can actually be utilized for something called complex medical care that can help you stay on track with all of your ongoing general needs and subspecialty needs as well. So you can look into your own insurance company website and see they will often have listings of how you can get an application or a phone call where you can talk to somebody about that. Specialty care. So we do talk about our general providers, our internist, our PCP. The specialty care providers are just as important right now. We have seen a fall off of patients getting their specialty care, including things like dental visits. Those are very important for us. There's lots of things that can happen during dental visits, including the cleaning. We're talking about things like looking at your general gum health, your tooth health, and making sure there's no pockets of infection that need to be addressed. We need to do regular eye exams with dilation so So someone can look back into the eye and make sure there's nothing brewing over there. Reproductive health, things like mammograms, cervical cancer screening or pap smears, prostate checks. These are all things that need to be done on a yearly basis, especially after a certain age. And then, of course, a mental health check-in. Can you go see your provider and have them refer you, if needed, to a mental health care provider in order to have either regular visits or maybe one-time visits to address specific concerns? All right, so we dealt with the general health measures. That was a lot. Now we're going to go into nutrition, exercise, sleep, stress, and infection control. Now, these are all things you can control pretty easily, or at least address pretty easily. So hopefully we can talk about these things in a productive way. Immunonutrition. So until very recently, nutrition was really just thought to be part of the building blocks of the immune system. But now we realize it actually also affects the function of the immune system, how we respond to infection, how we respond to stress, and self-reactivity. And we're looking now, lots of studies are looking at how these interactions affect your immune status. When we talk about nutrition, at least on the immunology side, we break it down into kind of compartments of what each part of our nutrition does. So we talk about macronutrients, micronutrients, antioxidants, and phytochemicals. On the upper left, macronutrients are composed of the protein, carbohydrates, and fat. These are the building blocks of our cells, basically. On the micronutrient side, there are vitamins and minerals. These components usually have to do with immune signaling and function. And then antioxidants like vitamins and minerals and phytochemicals, which are actually the colors and flavoring of plant-based foods. These are mostly used for anti-inflammatory, antioxidant, anti-cancer effects. So the macronutrient. In general, in the United States, we don't tend to have as many macronutrient concerns. The main focus of this is protein energy malnutrition. And this can come from limited food access, chronic pain, dental or feeding issues, medications, dieting, but most importantly for us, chronic disease and chronic infections. Luckily, we don't see this as much, but mostly it's the protein component that is missing when we do. And then the other three, so micronutrients, antioxidants, and phytochemicals. Micronutrients are contained in things like meats and some vegetables, and include things like iron, zinc, copper, selenium, and several of the vitamins. And then antioxidants and phytochemicals, as I mentioned before, are the anti-radical oxygen species fighters, and they tend to be lively colored fruits and vegetables that are most impactful for that. Finally, I didn't mention this before, but the fatty acids are also part of the building blocks of cell walls and should also be considered in a well-rounded diet. So speaking of probiotics, we've been talking about this a little bit more lately, so I thought I'd put a little bit about this in here. It turns out some organisms are actually good for us. Probiotics are actually organisms that are healthy and natural and live in your gut. They are fed by many different components of our food, and cultures, things that have cultures in them, actually promote growth of these little organisms. There are many different types of organisms: lactobacilli, bifidobacteria, enterococcus. They strengthen your gut barrier, they enhance immunity. The truth is, you can actually induce probiotic growth in your system by eating healthy foods that promote it, but you can also take probiotic organisms just by themselves through pill form. Overall, we generally lean more towards eating the foods to keep you healthy rather than eating supplementations. But if you're looking for foods to help boost that, it would be things with fermentation. So this is a picture here on the lower right of kimchi. Up above, it's things with cultures, as I mentioned before, like yogurts and fermented cheeses. There are other promoted foods that we do talk about, things like garlic and turmeric and echinacea and St. John's wort. I will not be able to talk much about these foods. There really isn't much literature on them other than for garlic. as long as you have discussed these foods with your primary provider or your immunologist, and you are taking them at safe doses, there's probably no concerns other than, the efficacy, meaning how well they're really working or not. So since we talked about undernutrition, we do need to talk about overnutrition. We know that fat cells actually can promote inflammation. They can promote overstimulation of your immune system and cause autoimmunity, that's self-reactivity. They can promote poor wound healing as well by this inflammation. And then because of all that, it does increase your susceptibility to respiratory, gastrointestinal, and liver infections. So how do we fix this? What do we do? Well, we need to look back at our nutrition and really take a good hard look at what you're eating every day. Maybe even take the time for a week or two to make a diary of what you're eating so you can kind of see where the proportions of your food kind of shake down. The best way to boost your immune system, which is one of the questions that everybody asks us, is to really include foods that are naturally rich in nutrients and vitamins. It's important to note that because the best way that the body absorbs food is through these natural forms. So fresh or lightly cooked fruits and vegetables are the most appropriate way and the most effective way to get these nutrients into your system, rather than things like supplementation and shakes. We recommend that you choose whole foods, foods that don't come out of a box, with less sugars for a better health and weight control. And if you have questions about foods, on the right-hand side of the slide, I added a little graphic that's the choosemyplate.gov. This is through the CDC that they have posted kind of 10 ways to a healthier you, and can discuss a little bit about portion control and the amount of each type of food that you should be getting every day. You'll notice that half of the plate on the bottom there is fruits and vegetables, half. So that's actually a really great goal. And the most important thing I tell people is to eat your colors. Whatever you do, as long as it's colorful and natural, you're going to be helping your immunity overall. Exercise. So we know that moderate exercise has been linked to lower risk of upper respiratory infections. I mentioned moderate because we're not talking about high-end athletes that are doing, really intense exercise every day. That's a different set. We're talking about, it's my New Year's resolution and I'm definitely exercising this year. So we know that it has been linked at that kind of intensity level to a lower risk of upper respiratory infections, and also has been found to have some anti-inflammatory effects on the brain. They did look at a population that was doing yoga. So it was a healthy population doing yoga, and they saw that there was increased IgA production in the saliva, which for us is a presumption of better infection protection, because that's kind of your first line of infection when you get to your mucosal surfaces. And then they also found decreased cortisol production, and cortisol is one of our stress hormones. So we assume that this is a decrease in stress level of patients that were doing it. Sleep. Sleep, we know it's restorative for the immune system. It's really important to actually take the time to give yourself adequate sleep hours. That's 7 to 10 hours a night, every single night. And these can actually improve infection outcomes, and it can reduce your infectious disease risk. When you don't get sleep in this kind of range on a consistent basis, it can actually increase your risk of things like cardiovascular disease, heart disease, metabolic diseases like diabetes, autoimmune diseases like arthritis, and then neurologic diseases like Alzheimer's. And this is because we have to achieve a balance. So it's really important that you don't have too much or too long immune activation, as is the case when you have an infection, which can infect your sleep. And equally, on the other side, when you don't get sleep, you have a translation of hormones and inflammatory mediators that will cause more disease. So it is a back and forth. The better sleep you get, the more calm your immune system is, and the more likely you'll be able to fight infections. stress. So I made a list here: genes, early life experiences, living and working environments, interpersonal relationships, diet, exercise, sleep, pandemic, you name it. All of these things we know converge to affect function. And this is a weight that you carry with you everywhere. Stress, we know, can actually lower vaccine responses. It can worsen infections and it can slow down wound healing. So it is important that we do address it as we see it coming and find ways to relieve stress. It's not just a matter of feeling better. It's a matter of your body working better as well. Infections. So we know we're going to get infections. It's inevitable. But it's important to remember that while you are dealing with these things, there are things that you need to address in terms of supporting yourself. Infections can cause nutrient deficiencies by reducing the nutrient intake. You don't feel good. You don't eat really well. You can have issues with your gastrointestinal system that causes loss of nutrients. You can have the breakdown pathways of nutrients that are changed while you're ill, while you're not feeling well. I found this interesting fact: a 1% change in your body temperature, like with a fever, uses up your energy as if you had walked 28 miles. It really takes it out of you. And no, it does not count as exercise for that week. But as you can see, being sick clearly drains your resources. So this is the time we really need to make sure we're supporting our bodies. When you're ill, what do? You should see your primary care provider. They should do an examination. They should make sure there's nothing more concerning. If it's a virus, that's okay, right? But if it's an infection that's bacterial and might need an antibiotic, then that needs to be addressed as well. So follow their treatment plan. As I've shown you through all of these other slides, rest and sleep is really important. Don't push yourself when you're not feeling well. Fluids are important. Our system maintains a lot of function based on kind of being filled up with fluids. Although we do mention less caffeine and alcohol, probably more water, maybe some soup-based fluids would be really helpful. The chicken soup thing is actually real. They've done studies showing that chicken soup actually does have some immune boosting properties. And then finally, maintain the nutrition variety as much as you can. Obviously, we acknowledge you're not feeling great. You're not about to go shopping and buy all these fresh fruits and vegetables, but whatever you can do during that time, rather than just eating a very narrow diet, would be really helpful for you. And that's where I'm going to stop. I put in some resources here for hygiene and nutrition, and I will pass it back over to Chris at this point, and we can do some questions.
Thank you very much, Dr. Dimitriadis, for underlying the importance of taking care of yourself when you have a primary immune deficiency disease. So at the moment, I don't see that we have any questions that aren't personal medical questions, but I've got one for you myself. You had mentioned the use potentially of probiotics to help balance the gut microbiome. For those with PI, are there any considerations, potential or possibility that those probiotics could themselves cause issues or cause additional problems?
Yes, thank you for bringing that up. This is definitely something you should review with your primary provider and your immunologist. There are a few subtypes of immune deficiencies where there might be a concern, certainly in younger infants with more severe immune issues, that probiotics could cause further infections. Overall, this is not the case, but I think if you review with your primary care provider or your immunology provider, I should say, about the risks specifically to your subtype of immune deficiency, you can still proceed.
Great, and I think that goes bearing, as you said there, that always seek the advice of your physician or the qualified health provider for any specific questions that you have about your health. Oh, wait, hold me. Oh, there we are. So that's funny. A question just popped up asking the same question I just asked. So I feel pretty good about that. So Perry, I see you out there. Hopefully that answered your question. I'm going to give folks just a few more moments to catch up to the questions here. So
I'll also mention, sorry, because just to go with that, the probiotic question marks about which probiotic is best. People will often ask that to us. And the truth is the studies really show that the probiotic that you use should be a mix of different organisms, which is better rather than just choosing one and going with it. It doesn't really matter which one it is, as long as it's more than one. Those have been shown to be most effective.
And, one of the things that struck me about your presentation, although you talked about things individually, I think on a holistic level, whether it's nutrition or exercise or obesity or getting enough sleep, how much any one of those issues, a deficiency or lack or not addressing that issue, can impact the others and become this cascading kind of spiraling effect down. And I know it's very difficult for folks with chronic diseases, PI and born errors are many among them. But even for myself with, being 55, I've got my own health issues. It's finding that inner strength to deal with that one part. And then once you break that chain, to develop that habit and how much all other things improve. So I know it's very easy for any one single system to go down, but I think it's really important for all of us, whether you have a PI or not, to understand that in nutrition and sleep and try and work on breaking that chain.
Yeah, and I think sometimes it's overwhelming. There's so many directions, so many things to be addressed that I feel like sometimes you need to sit down and write them all down and have them out in front of you on different cards and just decide what you're going to address now. Pick one of these things and just work at it and chip at it slowly. I don't want people to feel like, oh my gosh, this is too many things to do and I won't do any of them. I agree that just picking one and kind of focusing on it and saying, all right, I'll worry about the other stuff later, kind of walk through it slowly and see how you can impact things. But I agree, once you see one of these things working, it's really an amazing trickle down.
Great. And actually, we do have another question. So an individual asked, aside from wearing a mask and things, are there other things they can do to help improve their lung care? So that's a pretty open question, but I don't know if that means if they're breathing exercises or other things like that.
Aside from masking? Was that the question? I'm sorry.
Yeah, if I've read that, let me read that. Yeah, so it says, aside from wearing a mask, what other precautions that one can take to improve lung care?
Yeah, I think probably masking and making sure not to be in spaces where there are lots and lots of people where you would worry that there would be transmission in that way in terms of lung issues. All of these hand washing and preventive care guidelines are really helpful for any types of infection. And of course, the most common things that we transmit to each other are respiratory infections. So all of those kind of recommendations that we make are all based on, probably just because of the high amount of respiratory infections we do give each other, are all based on those.
Great, thank you. So if I can expand then aside from the mask question on that. So a lot of folks with primary immune deficiency also have problems with lung disease, lung impairment. Are there any, so I know for other disease states, sometimes there are breathing exercises to do to help strengthen lung capacity or things like that. Would that apply to any folks with PI?
I think it kind of depends on what your underlying lung condition is. Some of the structural problems with lungs may not necessarily respond to breathing exercises, but I will say in general, exercise, mild exercise, walking, things like that, can help improve lung function overall, can help improve stamina overall, in order to kind of support the respiratory system more. But because with deconditioning, which is what happens to us when we're not moving around as much, that certainly can impact our lung function. So making sure to address that in the opposite direction can be helpful. Great,
thank you. And actually, there's a follow-up to our probiotic question, which seems to be pretty popular, maybe just because I started talking about it. But please, folks, we've got some time left. If you have questions, ask away. We've got a great resource here for everyone. We still have a little bit of time left in the session. So this follow-up question here is, I've heard you should change the type or brand of probiotic every 90 days. Is this important and or true?
I have not heard that. I would just say that the best way to get probiotics in your system is to try and eat the foods that have the natural probiotics in them. And for that reason, you're probably not going to change the type of food you're eating, but those probiotics probably naturally change just based on what's coming to you in terms of the cultures. So it's possible that changing your product would be good. I haven't heard that anybody is necessarily promoting that for our patients, but I can't imagine that it's bad. I think, as I mentioned before, the variety is what's important. And so if that means switching it out every so often, I wouldn't even necessarily say a specific time frame, but every so often, that you can do that as well. And for that reason, why wouldn't you just do one every other day? I don't know that there's necessarily something specific in the time frame.
So I'm going to keep going on this probiotic microbiome train. It's obviously an issue that, well, I've been here 15 years and our folks many times are lucky enough to get some of the infections under control and some of the other issues. So along the probiotic issue, we know many of our folks are also prescribed antibiotics, whether it's for acute or prophylactically. Can you comment on how the use of antibiotics may impact the microbiome and the importance perhaps of using or considering probiotics as one is on these things?
Yeah, great question. So we definitely know that whether or not you're on daily antibiotic for prophylaxis or you're on intermittent antibiotics for treatment, those can definitely change what is the gastrointestinal flora. That's the good bacteria that grow in your gut. It can change them. It can reduce certain ones and it can increase other ones that may not be very helpful to your body. And for that reason, we do recommend oftentimes things like, while you're on this course of therapy, try and increase your amount of yogurt, right? We say things like, let's counteract as much as possible. So it is an awareness that we have, and it is something we do frequently recommend. Maybe we don't necessarily say it in terms of take an extra probiotic, but we will address, and it is something that we do see in this population. The other thing I didn't really talk about is prebiotics, which is the precursor to feeding these bacteria too. And that hasn't become as widely known, but it is being studied now.
So, there's another question about that. So outside of yogurt, what types of food products outside of yogurt might have some of these probiotic, and now you mentioned, first I've heard of it, prebiotic type strains. Yeah. So what types of foods are we talking about here?
We're talking about things that are fermented. So I mentioned kimchi, sauerkraut, pickling, things that are pickled do contain it. And then on the other side, things that are made of cultures that haven't been baked. So yeast, like breads, that doesn't work. But when you have a culture where you can continually feed it and allow it to grow, things like yogurt or fermented cheeses, aged cheeses, those are the things that can do that. Now, I fully acknowledge that some people are unable to do dairy. And so that's why we talk about the other fermentation products in order to do that. But in the end, if you are unable to do those things because of gastrointestinal issues, there are many products on the market that do contain various strains of probiotics. I would just check in with your primary provider to make sure that those are, worthwhile products to use on a daily basis.
Great, thank you for that. So the questions are coming in now. This is great. So up to this, keep them coming, folks. So a question on any recommendations regarding diet in order to reduce inflammation. So are there like diets out there that we can give as a reference, or plant-based diets, anything specific, or even general advice you can give to answer that, please?
Yeah, I know there's some movements now on the low inflammatory diets, low histamine diets. I can't say that we have studied those specifically in patients with primary immune deficiencies and found them to be particularly effective. What we know is what I mentioned before, is that whole food eating is the way to go, meaning things that are not in boxes, things that you can prepare easily at home. We're not talking about 5-course French dinners. We're just talking about fresh foods. Even frozen foods can also be healthy as well. So if you can't do fresh foods at home for whatever reason, frozen fruits and vegetables can also work. fairly well and giving you the support that you need. So I can't say specifically there's a diet to go with, but using that choosemyplate.gov can give you great ideas on how to structure a nutrition plan for yourself.
Thank you. And, I love the point you made about eat your colors, right? The vibrant greens and reds and oranges, all those sorts of things that we know have those phytochemicals, nutrients, micronutrients, and things in them that are good for us.
Brussels sprouts, powerhouse. That's your number one powerhouse. Maybe people don't love them, but if you were going to pick one that has almost everything in it, it's Brussels sprouts.
You know what? Olive oil, a little bit of salt and pepper, roast them in a convection oven. You got to get them nice and brown. Maybe drizzle some balsamic vinegar on them. Beautiful. I love those. I used to hate them as a kid. So, all right, I'm going to give folks just another minute here because the questions were coming in. As I'm looking, let me make sure I haven't missed any. I think I've gotten to all the ones that we have so far.
And I will say, I'm sorry if we're not addressing some of these issues. There are some things that I just can't speak to because I don't know everyone's particular immune deficiency concerns. And so it is, if we haven't addressed them, it's mostly just because they're probably so particular that I can't really know without that. So it's best that you address that concern with your primary immune provider.
Another question popped in. So we're talking about exercise before, and is there a certain type that is better for the immune system than other, like cardiac, strength, or so on? You mentioned a few in your talk.
Yeah, so the one that they did look at in terms of reducing stress and promoting kind of more mucosal immunity was yoga. So that's a lot of stretching. It's not really necessarily exercise. It wasn't necessarily hot yoga where you're sweating a lot. It was just mostly stretch yoga. So that's kind of an interesting thought. I don't believe I've seen anything that talked about particular types of exercise. Certainly things that probably would bring your heart rate up would be a little more overall system-wide helpful. But that being said, there are benefits to having both cardio exercise, so bringing your heart rate up, as well as strength exercise. And those benefits can be things even outside of primary immune deficiency. Bone strength, muscle strength can help support spine and alignment and things like that too. So I would say there's not one thing that I would tell people to do. And in fact, I would encourage you not to do just one thing and to try and keep variety in the exercise that you're doing.
Right. When you mentioned raising your heart rate, right? Is that for a certain amount of time? How does one figure out what their appropriate heart rate is, right? I think I've seen, right? It's the number 220 minus your age is your maximum heart rate. And maybe you want 60% of your maximum heart rate for a certain amount of time. Can you comment on that?
So this is certainly person dependent and underlying disease dependent. So if you have heart disease, this is a very different conversation than if you don't. This is certainly something I would address with your primary provider who knows your medical history better. But overall, I would say, number one, start very easy and slow. The worst thing you can do is try and hit your maximum heart rate the first day you're exercising, and then you will never do it again because it is highly unpleasant. So what's important when we talk about exercise and even nutrition is setting small, manageable goals and being okay with that. It's okay that this week I'm going to walk 20 minutes for 3 days of the week. And that's it. And that's all I do. And maybe I do that for a month and that feels good. And maybe I do it for another month. And maybe the next month after that, I go up to 30 minutes. This is about fitting this into your lifestyle, making it a habit. So they say it takes about 6 weeks in order to really establish a habit. So you have to do something for at least that long. So pick something that's very easy, and then you get to make your adjustments on your terms after that. So it's more helpful for you in the long term to set up something that is manageable for you rather than, oh, this is my end goal and I need to get there in a month. That's kind of, this is what I want to do this week. And then we'll readdress this next week and see how well I did last week. And if I adjust up, great. And if I adjust down, just fine. I just need to make it something that I will be successful in continuing.
Great. Excellent answer to that question. Thank you for that. So I think I'm going to give folks a few more seconds here to ask any more questions, because if we don't, we're going to close out. I tell you, we're talking right before this started, and I don't know how many conferences I've been to now at IDF. It's been a lot. And every single time I learned something new. And it doesn't matter if it's a presentation or a speaker like yourself I've seen before or I've worked with, I never failed to learn something new. So personally, I want to thank you for that because I've learned a lot today from you. So thank you. So that
Thank you.
Oh, of course. So that being said, I don't see any other questions coming in, folks. 3, 2, 1. All right. So our time together has come to an end. Thank you very much, Dr. Dimitriadis. I think I got it right that time. It's been an honor to have you join us today. For everyone else out there, enjoy the rest of the conference. There's a ton of programming out there, excellent things to learn. We've got networking sessions coming up soon for everyone. And don't forget that we've also got these sessions recorded to watch later or to watch again. So with that being said, thank you very much for joining us today.
Thank you.
Bye.